We spoke about food, and now we're going to talk about digestion and sleep. And one of the things we tend to do, everyone, is we usually eat too quickly. You might eat too many carbs, don't drink enough water, and that can cause your digestion to really become sluggish and have it be harder to absorb the nutrients of the food that you're eating. I don't know about you, but sometimes you spend 30, 45 minutes preparing a meal, and you sit down, and it's done in 10.
Thanksgiving.
Thanksgiving, there you go. 4 hours for 15 minutes. So one of the solutions is mindfulness. And I'm going to give you some great exercises that you can do when you eat to become more mindful, is to actually take a bite and put down your utensils. And chew, and really taste your food. It's amazing how many times, if you start being mindful about your eating, how many times we'll shovel more food in while we're still chewing the first bite. So they suggest around 20 to 30 chews per bite, which is a lot if you start counting. Thanks, God. So I tell my patients, shoot for 15 to start. Just start having an awareness of how many bites, how many chews am I doing? And if you have kids, I heard you mention grandkids. We often, and I have a 9-year-old, so in our house sometimes we'll see who can chew the most. Just as a little fun and just kind of awareness, because I see him modeling what I'm doing, so I need to remember to slow down too, and then that helps. The other people at the table will pick up the cues of what's going on. So if you're just having friends over for dinner and you start slowing down and putting down your utensils, it's going to change the energy of everybody eating there. And the other thing is it takes your brain 20 minutes to register that it's full. So the connection between the brain and the stomach. So if you're gobbling a whole bunch of food in 10 to 15 minutes and you're eating way over what your stomach really needs, it's not going to register it's full until 20 minutes have gone by. And then, like Thanksgiving, what happens is your stomach goes, oh my God, I am so stuffed. And it's because you didn't slow down so that you can get the connection with the brain and the stomach and give it enough time to register and say, okay, you're starting to get full, so you might want to slow down what you're eating right now. And then water. Water is really important. I can't tell you how many patients come to me and with a whole list of ailments, and my suggestion is water. And they come in a week later and they go, oh my God, I can't believe it was just water. It changed my life. So everybody says, well, how much water? And I just tell a rule of thumb, about half your body weight in ounces. So if you weighed 100 pounds, you'd shoot for 50 ounces. And the other thing to think of is that you don't have to go out and go, okay, she said I need to drink 80 ounces of water, and tomorrow I'm going to drink 80 ounces of water. I just suggest start slow. Again, it's that whole 1 degree thing. Just add 1 more cup. If you realize I'm only getting about 40 ounces and I really should be getting 90 ounces, then just add 1 more glass of water in your day. And that's easily done. You can start your day with water. How many of you wake up and you really feel thirsty? Yeah, so your body's gone all night long with no water, and then a lot of times people wake up, they're thirsty, and they grab their tea or their coffee or whatever, and they're not hydrating. They're actually dehydrating themselves further because it's a diuretic. So start with water, and I like to suggest you start your day with some warm water and lemon. It's a great way to start your day. It changes the acid-alkaline balance in your stomach, and it also helps with digestion, and it'll just get things moving, and it's really soothing and nice. So I love my cup of warm water in the morning. The other wonderful thing about staying hydrated is it increases your metabolism by about 3%. So if you're staying hydrated, you're actually going to be able to keep your metabolism going a little bit more. And then digestion. I forgot to mention one other thing. The reason you really should chew so consciously is because digestion starts in the mouth. And there's no other teeth along the way to break down the food. It's going to digest with the hydrochloric acid in your stomach, but you really do have to chew your food really well so that you can have better digestion along the way. And as we age, the stomach naturally produces less hydrochloric acid, and that can be abbreviated as HCl. And what happens is that we don't have the digestion. It doesn't work as well. So one of the things that you can help to increase your hydrochloric acid is not drink water or liquids with your meals, and don't drink right before you eat, because you're actually squashing and diluting the hydrochloric acid in the stomach. So if you don't eat during your meal, you're really enabling your stomach to digest very nicely, increase its hydrochloric acid, and then you can drink after your meal. Give it a little bit of time to digest. And there are products out there that will increase your hydrochloric acid. You can just buy HCl in the grocery store, or I use a Standard Processes IPAN product. The other little handy tip about hydrochloric acid is if you're going to a restaurant that maybe you haven't been to before, you can take a hydrochloric acid tablet before you go. It will increase your hydrochloric acid in your stomach, and it will avoid you catching anything. So say you're in Mexico and you're going out to eat. You can actually, if the more acid you have in the stomach, you're going to kill more of the germs.
Wow.
So it's a handy little travel tip to take hydrochloric acid when you're going on traveling, because you don't know what you might be eating or that sort of thing. And it's really important that your intestines have good bacteria. And so I like to suggest a probiotic. And one of the reasons that that's so important is because about 90% of your serotonin they're finding is now produced in the gut. And serotonin is the hormone that makes you happy. And they're starting to do studies now where they're finding out that there's a connection between poor digestion and depression. So in a lot of psychological studies, so a lot of psychiatrists and psychologists are starting to work with their patients with probiotics and digestion to really help them feel better and increase their moods and their levels. Because that's 90% of serotonin in the gut. That's huge. And it also increases your immune function. The better your digestion is, the better your immune system is. And fiber. Fiber is really important. For men between the ages of 19 and 50, about 39 grams of fiber a day, and for women it's about 25 grams. And fiber that's the plate, the veggies. You know, make sure you've got a lot of veggies. Those are going to be really good for your dietary fiber. And if you're feeling like you're not getting enough fiber, you can add a fiber drink to your day, some kind of shake or something with fiber in it. And so, remember how I was saying we were just talking about the stomach acid? I had a patient who she was complaining of acid reflux. And what's so interesting about that is acid reflux is actually a lack of stomach acid, not too much stomach acid. And so she was taking the Nexium, the little purple pill, and so she was squashing her stomach acid, and she was continuing to get heartburn, and it just wasn't really working for her. So I suggested she stop that, just give this a try, and told her to increase her hydrochloric acid. You can do that with lemon water, she could take a pill, or one of the products that I had in my office. And so she said, sure, I'll try it. So she tried it, and she took one of the pills that I gave her right before she ate, increased her hydrochloric acid, her digestion was so much better, and the acid reflux stopped.
Wow.
So it's pretty amazing that if you can just get your digestion going really well. I also told her, don't drink with your meal, make sure you chew, just all the things that we had just talked about to change your digestion a bit, but she added in the hydrochloric acid, and it made a huge difference, and she was able to stop taking the pill whenever she ate, and her digestion went back to normal. So it's really exciting when you can just make those little changes like that and get your body to function better rather than depending on some prescription that wasn't helping in the long run. It wasn't making a difference in her body. Yeah. probiotics are things that are put in the good bacteria into your intestines. So I have a product that I like that's a little packet, and it's stable at room temperature, so I can travel with it. If people are having a lot of gut issues, then I suggest probiotics every day for a while until we get their gut health going. But generally, I tell people just have a probiotic every few days. So you can actually eat a probiotic yogurt in the grocery store, they have them, or you can get the little packets. I like the ones that are stable at room temperature, because otherwise the other ones you have to refrigerate and you can't travel with them. And it's really good to have a probiotic when you travel, because that's going to keep you healthier. If you go on an airplane, I take a probiotic before I go on an airplane because it increases my immune system. So you don't have to down a whole bunch of vitamin C, but you know that does help. But I find that it's really effective to take a probiotic before I travel, and that will increase my immune system. And if you want more details after, like specific products, anything that I mentioned here, I'll be happy to talk to you about what I carry and the brands that I've tried that I find very effective.
So there's the food side of digestion. Would you believe there's an exercise side of digestion? One of the best things for keeping your digestion in good shape is exercise, and specifically twisting. This is called twisting. So when you're standing around online at the post office, you can admire something over your shoulder. What happens when the digestion doesn't work is exercise helps move things. In increasing the metabolism, it's increasing the speed that things move through you. Aerobic exercise raises your heart rate, right? Raises your breathing rate. So that's the second part of fitness, is cardio, aerobics. And that stimulates the natural contraction of the muscles to help move stuff around. I thought that was fascinating about digestion, serotonin. When I look at all my depressed clients, they all have gut issues. Yeah.
It's pretty amazing.
Yeah.
Yeah.
So when's the best time to exercise?
Whenever you can.
That's an ideal answer. Yeah. There are some times that are less good than others. After a big meal, not the best time. Yeah, because your body wants to use its energy to digest, so you don't want to use it for exercise. You want the blood flow to go to your stomach and not to your heart. Exercise is great for constipation because it's changing the way the body absorbs water by moving stuff through your system. The best prescription is, whatever you're doing, add 10 minutes. So if you're not exercising, now I know you exercise and you exercise, and okay, cool, excellent. So for people who are already doing exercise, if you're still having trouble with your digestion, to add 10 minutes could be walking up a hill. Just whatever you're doing, add 10 minutes. Stretching can help so that everything isn't, our culture is a contract forward culture, right? Everything starts. As we get older, we collapse, everything. So stretching this gives more space for the guts, so they're not going to work as well when they're being squished. So let's see, you want to see a couple of moves that can help your digestion? Let's look at a twist in a chair. And the best way to twist in a chair, believe it or not, is to send your feet over I'm going to steal one of these chairs. You can replace Jonathan's table. I use them as tables too. Is to put your legs over the side. Oh, let me turn it around. Yeah. And then put your hands on the back of the chair. So how do I describe this if we're all, the back arm,
You should be on the other side of us so we can actually see you.
oh, because you've all turned around now. Okay, good point, good point. Right, usually I catch that, so watch first so you don't turn away. All right, let's see, you're both this way. So the back arm pushes and the front arm pulls. So if you push the back corner, your body will continue to turn over that shoulder. And this one lets your other shoulder go the other way, right? So this pulls your shoulder in, this pushes your shoulder away. Don't do maximum, don't do too much. Sit upright, Erica.
I'm stretching my back.
Cool. And then flip around and do the other side. And you may notice that one side goes a lot more than the other. So the back arm pushes and the front arm pulls that back shoulder in. Yeah. Breathe. Nice. So anytime you find yourself sitting in a chair, except the office chairs with wheels, this is a good thing to do. Or if you have arms. It doesn't work really well with chairs with arms. But if you're in a school, those are hard on adult bodies. The little, really?
Yeah,
That's great.
Then my feet touch the ground. Little bitty chairs.
So you can show the kids
Yeah.
little bitty twist. So the twists are great for all sorts of stuff,
I do this one.
including, now twist and driving is a good combination. I actually recommend that.
Look over your shoulder to see.
No,
You'd be surprised just how much mobility you have. Let's see. And you can still keep your eyes on the road, right? So there's your foot, and you can, There's a lot of mobility in a car, because car is one of the places where people lock up. Driving. And then you wonder why you hurt when you get out. When in fact you can, I support you in twisting around while you're driving.
The reason I mention the driving thing so often is that sometimes that's when I feel the sciatica the worst.
Yeah.
Even with the lumbar support that I have and the rest of it. Well, like my drive to Sacramento and back, or even to East Bay and back.
Yeah.
It's that stagnant or stationary
Correct.
thing of doing a little bit of this and the tension of watching the goofy drivers everywhere.
Correct.
There's a tension in driving, and
The worst position for your back is the one you're in.
yeah.
It wants to move. Yeah. Different scope. Let's look at another one that you can do in a chair. That's good for digestion. So do you think if your stomach muscles were in better shape, your digestion would be better? Yes. So do you believe you can work stomach muscles in a chair?
Sure.
There's actually two different things I'm going to show you in a chair. One is called ab vacuums, which you can do while you're driving. And we're going to just pull the belly in, just suck it in as much as you can. Just pull, 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 pull. Yeah, and then push it out. And then pull it in. Yeah. And you can exhale there. And push it out. There's a whole other issue about how we breathe. But the work in the abs is just pulling the belly in and pushing it out. If you want to get your breath in line with your muscles, exhale when the belly's going in, which is the opposite of what most of us do. Yeah. So there's the air. Think of it as somebody punching you in the stomach and knocking all the wind out of you. That's how I remembered it for years. And then push it out. Yeah. If you do that enough, and I can feel anyone else hear their stomach gurgling? Because it's moving stuff. Yeah. It's like, oh, we're moving. And it starts to respond, and your digestion starts to respond. Thank you. That can be done anywhere. And depending on what you're wearing, it may or may not be noticeable. You know, I mean, if I were sitting up here doing this, you could see it. But a lot of times, I think in that, you could see it if you're looking, but, you know? So certainly you can sit and drive. These are great for stop signs. These are great for 101, you know, boring highway.
No, that's 5.
Highway 5, yeah,
Highway.
yeah, okay. I actually had a student who dropped a couple of pant sizes doing this. That's an added benefit because it's pulling in your inner abdominal muscles, and we're going to talk more about abdominal muscles later. I'm just thinking about, I think we'll do the rest of the abs later.
Okay. You good with your digestive moves?
Yep.
Cool. I like that one. I'm gonna try that one.
That's
in
cool.
the car.
Yeah, yeah.
I spent a lot of time in the car.
Well, and you know, you can tell if you're getting stronger, because I see a lot of people when they start, there's not a lot of movement. You know, you pull your belly in and out, and there's not much movement. And then as you get stronger, there's like, whoa, there's a lot of
Like
movement.
those
you know?
yogis who can
Oh, the belly
Make their-
dancers. I can't do that.
make
Yeah,
their
put
stomach
one
do
muscle
those
at a
things.
time.
I can't do that.
It's just wrong.
This is wrong.
Well,
You're
and
right.
actually that's not the same as strengthening your stomach muscles, because I have clients who belly dance who have weak stomach muscles. Go figure.
Right. I think
It's
I
just
think
a
that's
different
Yeah.
That it's
use of the
loose
muscle.
hips. Yeah. So, do any of you have trouble sleeping? Is that sometimes an issue? Okay. Do you ever wake up in the morning tired? Like you feel like you've slept all night, but you're still waking up, and it's just a little tired in the morning. Yeah, that can happen. Well, a lot of times people go to bed way too late. I'm going to talk about really the ideal time for your body to go to bed. And the other thing, remember we were talking about serotonin made in the gut? Well, serotonin is made while we sleep. And so the better you sleep and the better quality of sleep that you have, the better quality you're going to have of your ability to make serotonin, which is your happy hormone. And then that decreases your cortisol, and cortisol is your stress hormone. So good sleep equals more serotonin and less cortisol. And also when you're sleep deprived or you're not sleeping well, your body's going to hold on to more fat, and because the cortisol levels are going to be higher. So they found that if you don't sleep enough or if you don't have the quality sleep, it's harder to lose weight. And so that's why sometimes you see those little blurbs that come up and say, you know, lose weight with your sleep. It's just if you sleep better and you have quality sleep, your body will start reducing cortisol, and that will help you reduce fat. So a couple things, I've got a list of some things that will help you sleep better. And the first one is eating better. So if you follow the routine, like I was talking about, getting up and eating in the morning within 1 hour, eating every few hours, eating some protein throughout the day, those are the types of things that are going to help you sleep better. Dinner between 5 and 7 p.m. That's the best time for the stomach to digest. In Chinese medicine, every couple of hours, meridian, and that's your energy system, becomes active. And it's the best time for that system to do its job. So between 5 and 7 in the morning is your colon, between 7 and 9 is your stomach, and that in the morning for breakfast. So that means between 7 and 9 is the low time for the stomach. So if you're eating dinner after 7 o'clock, you're actually just eating when the stomach is really asleep. It's not fully ready to digest and wants to do its best job. So eating between 5 and 7 is really the best time for the energy of the stomach, and it's going to increase your digestion. Move your body every day. Dot's handling that part. But if you do move your body a little bit every day, it's going to help you sleep better. No caffeine after 11 a.m. I don't know if anybody does caffeine, but that's even black tea, coffee, green tea,
Is green tea
hot cocoa. I like to, if you want, I ask people, I suggest that if you don't do caffeine, green tea, you feel it. you
Yeah.
feel the caffeine, right? So if you do that after 11 a.m., it's still going to affect your body. So a decaffeinated green tea in the afternoon is a better suggestion. And the reason I suggest that is because it takes 12 hours for your body to completely process caffeine. So that's why I put it on at 11 a.m. so that you can be getting to bed before 11 p.m. And you sleeping, it will help the quality of your sleep. So even though you might not feel all caffeinated or wired, your body still has some caffeine, and so it's still kind of ramped up a little bit. And it's not gonna sleep as well.
I've noticed that in the past few years, chocolate after noon keeps me awake.
Yeah, chocolate falls into that category as caffeine as well. And a lot of people can't eat chocolate for dessert or have chocolate in the evening. My mom's one of them. She'd stay awake all night.
So
Yeah.
now I eat chocolate after breakfast.
There you go.
Just
There you go.
I like that.
I'll give it up. But really, just a little piece satisfies.
I do. I have some information on stress, and one of the things that if you enjoy chocolate, a small piece of dark chocolate is actually perfectly fine, and it does help reduce your stress.
See?
So there you go. So you're doing great.
In the morning.
One of the things I was taught in a TAM program, which is a hospital thing, is the first bite of like a sweet is 90% of it.
Yeah.
So you take one bite, like the free samples it sees. I've done that. I've gone in and taken a bite of it and thrown the other half away. And that's totally satisfying because most of it is smell.
Right.
And you take the rest of it is empty, done calories.
It's
The
diminishing
thrill of the
returns,
chocolate,
yeah.
the sweet, and the rest of it is all satisfied in one bite. And you know, what Dot was saying was, you know, you don't need to keep on doing it.
Right.
You know, just one bite and it'll, I found that to be true.
It
And
satisfies the
people,
urge.
it amazes people. I'll take a bite of a cookie or break off a piece and give it away or just throw it away. You know, just that first bite. I have a sugar tooth and a sweet tooth, and like, that's the way I do it. It's just have a little
Just
bit.
have that bite.
And then wait the time, and it does it.
That's a really good suggestion. I
Yeah.
like that. We're going to talk more about sugar.
And there's a See's candy right down here. So
We can all go try
We can go out on the break and get our sample.
Why do I think that's probably not the one Donna's going to recommend?
But we will talk more about sugar, and I'm curious about your ability to just have one bite. So it shows that your brain chemistry
Exactly.
is balanced around sugar. But
Yeah.
I don't want to jump ahead yet. So bedtime rituals. Getting ready and telling your body that we're going to go to sleep soon. So instead of staying up and I got to check my Facebook, or I got to check my emails, or I'm going to watch the news and then I'm going to turn off the TV and go right to bed. What you want to do is back it up about a half an hour. So if your bedtime's at 10, you're going to, around 9:30, you're going to start doing your bedtime ritual. You get in your jammies, you brush your teeth, wash your face, whatever it is, take a hot bath, whatever it is that gets your body into the bedtime ritual, your body's going to start slowing down and knowing that it's time to go to bed. One of the things that I do before bed is I use something called a chi machine. I don't know if any of you have heard of it. It's really great. It's this little machine. It's not expensive at all on Amazon. And you put your ankles in it, and it wiggles you like this, in kind of a figure 8 pattern. And what it does is you lay on the floor, and you put your feet in there, and you can do it for 10 minutes, and you can slow it down so it doesn't shake you all over the place. And it's a good health thing for lymphatic drainage. So it's very subtle movement, but it helps the lymph drain and keeps you healthy. But what I find is it's a signal from my body that we're going to bed. So I go, and that's the last thing I do before I get in bed, and I can't tell you how many times it stops, and I go to sleep. And my husband's like, I was wondering, you didn't come to bed for like half an hour, and I was like, I fell asleep on the chi machine. Because it just gets my body, for me, it feels like it shakes off the day, and it really gets me relaxed, and then I get in bed. And so for me, that's what it signals. That's a signal for my body. So do whatever it does, whatever you like to do, that tells your body, hey, we're getting ready to go to bed, because you're going to start putting out the melatonin. Make sure your room is completely dark. That helps with melatonin as well. And in reference to that, no TV 1 hour before bed. TV is too stimulating. You're laughing, Susie, is that what you do? So back it up, no TV. If you've got a show that comes on at 10 o'clock, you can DVR it or record it or watch it later on your iPad. Or there's so many ways to watch TV now. You don't have to watch it when it actually comes on, but I don't watch TV, so but I know that there are other ways. So no TV before bed, and if you happen to have a TV in your bedroom, do any of you have your TV in your bedroom?
But I don't watch TV.
Cover it.
Yeah.
Cover it with something. Put a nice sarong over it or something like that. You're looking at me like I'm crazy.
I just don't look at it.
Well, it's also
Almost
it's
emits
a
something.
feng shui thing, and it does
Yeah,
emit
that's
the
a good
EMFs, and so it makes your room, your bedroom, the sanctuary for sleep. So you want to make it as sleep comfortable and conducive as possible. So don't sleep with your phones near your head. Put those in a different room, plug them in a different room. Try not to have a clock that's got the big red letters, so you have a red glow in your room all night. Those things will really help sleep. They found that just a teeny little bit of light will decrease your melatonin. And so no nightlight in your room. You can have the nightlight out in the hallway. After I heard a doctor lecture about melatonin, I came home and I took the nightlight out of my son's room. And I was like, you can sleep without it. And he sleeps better.
Interesting.
Yeah, he sleeps better without it. So it's in the hallway. If you sleep it up in the night, you'll be able to see. And bedtime. Again, remember we talked about the meridian in the system and how your body works and functions, and what's the absolute best time to go to bed is between 9 and 10 o'clock at night. I can see what that's 1% of change, 1 degree of change is going to be. I have a lot of patients who come in and they get to bed really late, like midnight. They're up doing laundry, whatever. What you want to do is, if you are getting to bed later than 9 or 10 o'clock, you want to back it up 15 minutes per week. So just get to bed 15 minutes earlier for a week, and then 15 minutes earlier for the week. And that will slowly change your body so that it gets used to the bedtime. And I tell you, at 8:30, my body is like, we're going to bed soon, right? You're going to start getting on that chi machine and getting to bed. And on the nights when I work late one night a week, and that's the toughest morning. Friday morning, I am just dragging my butt because I'm getting to bed at 11:30 by the time I drove home from the city, because I see patients late at night. And it will really make a difference if you get to bed earlier. The Chinese medicine part of that is that at 10 o'clock, what happens is the meridians that become active are the ones that restore and replenish us. They're the things that rejuvenate us. And that's why 11 o'clock, you kind of get a second wind. And you're like, oh, okay, I feel better now. I'm going to do a few things. I'm going to stay up another hour. That's actually the energy that you're feeling. That's the energy that restores and replenishes and rejuvenates us. And we're burning it out. And we can do that in our 20s without too much complication. But as we age, it makes us more tired. It makes it harder to get up in the morning when you don't go to bed at the right time. They also find that your brain cells, Western medicine has studied, and brain cells regenerate differently before midnight. So you have brain regeneration, and we're talking about Alzheimer's and different degenerative diseases in the brain. You actually have brain cells that regenerate differently before midnight. So getting to bed earlier helps.
So I have a question about that. Does it matter when you go to bed more important than how long you sleep?
I suggest you sleep from 9 to 5 or 10 to 6, so a good 8 hours. Some people do need more and some people need a little less, so between 7 and 9 hours. But it is more important that you start at 9 or 10 o'clock at night. Because some people tell me, oh, I get 8 hours, but I go to bed at 1 o'clock in the morning and I sleep till 9 or 10. You've just messed up your whole, your intestine time, your breakfast time, and you're burning out your other energy that restores and replenishes you. So it is really important that the bedtime is at that, before 10 o'clock is what I say. And then from there, sleep the amount of hours, you see how it feels. The other thing that I notice is when you do get to bed earlier, the quality of your sleep is so much better that you tend to not need 9 hours sleep. That 8 hours does work, or 7 hours does work. So it's actually a more quality sleep.
That's a great question, Susan.
And so I usually have, like I said, I have some patients who want to stay up late. So my suggestion is 15 minutes. So if you're starting at 1 o'clock, if you're going to bed at midnight or 1 o'clock, just back it up 15 minutes per week and do the bedtime ritual and start getting your body knowing, like, we're going to bed and we're going to bed a little bit earlier. And you're going to start feeling more energy, definitely. And the other thing is when you sleep better and you have quality sleep, you're going to wake up with less aches and pains, and you're going to feel more refreshed when you wake up in the morning.
What about reading? Is that stimulating too?
You can read before you go to bed. I usually tell...
Good question.
Yeah, that's a really good question. I think that reading before bed is fine. It's less stimulating than watching a movie or a news, but it depends on what you're reading.
Oh, yeah.
Because
yeah.
remember, your body doesn't know the difference between reality and fantasy. So if you're reading something that's kind of scary and got your heart pounding, and then you're like, okay, now I'm going to go to sleep, that it's kind of not conducive for that. But if it's something that is not highly stimulating, like some of the things that I read.
And what's the point? Textbooks, yeah, I can say you can read textbooks.
That's the kind of thing I read. 2 pages and I'm out. I would say keep your stimulating reading and TV and those sort of things to earlier in the evening. And if you want to read a little bit before bed, just choose your material wisely. Good question.
So I'm going to talk a little bit about aches and pains.
All right.
How many of you have ever had aches and pains?
Oh, yeah.
I think there isn't a person around who hasn't. So, and what I hear from my clients is, I'm starting to wake up in the morning stiffer. Some of them will say, it goes away after a few minutes. And I think, so do you think it's going to stay like that? You're just going to wake up stiff for a few minutes? You know, it gets progressively worse. I have clients who tell me they're afraid to bend over and put their socks on if it's too close to when they first got up, because they know their back can't handle it. So I don't know if that's true for any of you. My guess is your back doesn't feel great first thing in the morning.
I got it down pretty well.
You adapt well.
Yeah.
So, do you know that aches and pains are not a normal part of aging?
Yeah.
They really aren't. I wake up, my poor partner, I try not to do this to wake him because he's still sleeping. Yeah, I tell that to John about time of sleep, 1 to 9. He's a 1 to 9
Some
sleeper.
people are just, they're
Yeah.
really regimented and they swear they're a night owl. But if they change it, they're not really a night owl. It's just they're burning out.
I
their
bet that's
energy.
the same as people who tell me, no, I can't eat breakfast. And you say that's because you're eating too much at night, and you take the food away at night, and guess what? They're ready to eat breakfast. I mean, I see that one all the time, so I can believe it about sleep.
Yeah.
So the trick to not waking up with the aches and pains is to keep the body limber. So the third component of fitness is flexibility. What if you knew exactly what to do to keep your body from getting stiff? Or to keep those aches and pains away? Because, well, you know, very specific moves will keep away very specific aches and pains. I wake up awake. I'm awake. I try not to bounce out of bed so John can still sleep, but awake, no problems, alert, touch the toes. And that wasn't always the case. So, in terms of anti-aging, cardio helps the digestion, Flexibility helps the aches and pains. Strength keeps your metabolism up. So 50% of our population experiences neck and shoulder pain, 80% of our population experiences back pain. I had a woman come to me with sciatica. If you've ever had that, it's really painful. And the doctors say, you know, maybe you need surgery. And I just looked and said, okay, this is what I think your body needs. You know, we played a little bit. And sure enough, I got her pain to go away, 95% gone. And the trick is just learning what exactly does your body need. Aches and pains are usually in the joints. The joints are doing the work of the muscles. Because remember, you're losing your muscle mass, right? Well, that means you're losing the functioning of your muscles also. They're getting tighter, stiffer, and less flexible. So like knee pain tends to be the quads are too tight, and then they're not strong enough. So when we know what muscles need stretching and what muscles need strengthening, joint pain tends to go away. And that's true for the neck, the shoulders, the back. It's true across the board. I can't tell you how often I hear, if I'd known this was going to be this easy, I would have done it a long time ago. Now, it isn't always easy. I know you've had a long story. So do you want to see how some of this works?